Welcome back. We remind you that we are standing by for Prime Minister Dr. Keith Rowley hosting a press conference this afternoon at the Diplomatic Center, and we are bringing you live coverage. We now take you to the Diplomatic Center to the Prime Minister, Dr. Keith Rowley.
And I thought I was late. Yes. Good afternoon, members of the media, members of the viewing and listening public at home and abroad. Thank you all very much for tuning in to our continuation of the management of Trinidad and Tobago's COVID responses. Last time we were here, we made some references to our platform of phases, and we made some adjustments and some announcements, and we indicated that all staying on track and being well, we would make some further adjustments by June 8th. So I would like at this time to ask the Health Department, led by the Minister of Health, to make a short intervention, and then we'll have our doctors give us a longer description, and then you'll come back to me and we'll deal with the adjustments.
Thank you very much, Prime Minister, and I will be short. Good afternoon, ladies and gentlemen of the media, colleagues, listening and viewing public. The clinical report for today is samples submitted 3,330, community samples 1,477, unique patient tests 2,874, number of repeated tests 456, number of positive tests 117, number of deaths thankfully has remained the same at 8, number of patients discharged 108. At the home of football, we still have the family of 3, with that one patient who tested positive last week Saturday, and I am told as of yesterday that patient received their first negative test, so that's some good news there. In the parallel system, we currently have 92 persons, and they are distributed as follows. At the UWI Penal Campus, 52. Cascadia is now down to 2. Tacarigua, we have 29. And Napa, which is reserved for staff only, healthcare staff, we have 5. And Homer Football, as I indicated, 3. So that's the report for today. Thank you very much, Prime Minister.
Nothing additional from the doctors, but they'll remain available for question time. Okay, let me back up a little bit. Basically, for reminders, we did start our phase 1, phase 2 out of a 7-phase program to reopen our country, which had seen us basically closing down all non-essential activities. So we've got through phase 1, where we had shut down food establishments and non-itinerant businesses were allowed to commence curbside pickup later on and so on. Then in phase 2, we opened up manufacturing, food and beverages, and construction, and some aspects of motor vehicle servicing, laundries. Phase 3, which was the last time we met, we opened up the public service, and we were operating at a certain a 50% level with flexi time available. We opened up retailing, car dealerships, professional services. We had public transport at 50%. We opened up the malls. All of these to 6 p.m. In the daytime. And we did say then that the public service will continue, and we most importantly promised that those small businesses and personal services, hairdressers, barbers, spas, would be opened up on June 8th. Today I want to confirm that we are sticking with that. So as of the 8th of June, all, what is the Minister of Communication smiling about? You didn't seem to be having any butter? Hairdressers are available for all those who afford themselves of that service, or spas, or barbers, those of us who require to have or grooming at the top of the head. Domestic workers, all housekeepers, gardeners, maids, all home service workers would be available from the 8th. And of course, we would, from the 8th, allow public transportation to operate at a 75% capacity. So all public transport, whether it's private or the public sector transport. So there's more public transport available from June 8th. And we did say then that there were some things that we would be doing on the 22nd. According to our original plan, we did say that July 5th we'd look at reopening of places of worship. But because we have managed to keep our numbers down, and the numbers are what they are, today I can tell you that we've taken the decision to allow places of worship to open up activities from Friday the 12th, which is next week Friday.
Yes.
And all places of worship would be available for use, but with certain restrictions. And the restrictions are these. Keep the protocols for sanitation, sanitizing. Keep the restrictions for persons separating by occupying where pews are available, alternate pews at arm's length. And that means that depending on the size of the facility, that will determine the number of persons involved. So alternate pews, persons at arm's length. And sanitize, so it means that also persons attending all of these services, whether they're in mosques, mandis, churches, wherever, that you wear a mask. There's a requirement to wear a mask in that gathering, because what we are doing here is increasing the number of persons, and we are asking the managers of these services to limit the exposure to 1 hour. Yeah. So we believe that those protocols will allow us to get back to our community services. And of course, there would be protocols issued from the CMO to manage this. And the number of services within a church or a cathedral, you can have a larger number of services during the daytime, but at any one time, the occupation should be as described in this way. What we are trying to do is to get people back to their community services in their various places of worship, but we are also limiting the exposure within those structures. That should bring a lot of relief to all the people who are anticipating their community, church, and place of worship services. By June 22nd, which is 2 weeks from today, by June 22nd, the public service should get back to normal, reporting for work in a normal way by June 22nd. So between Monday and the 22nd, our public service managers should take all necessary steps to receive and to encourage them to have staff in. So between now and the 22nd, they will continue in the rotation arrangements, and they will do the alternate days and so on. But from the 22nd, all services should be available utilizing all the employees of the public service. Again, following the arrangements of distancing, sanitizing, and reducing gatherings to we're increasing the number of persons who can congregate to 10, so groups of 10. And of course, we're saying that by the 22nd, all public transport should be operating at 100% capacity. So by June 22nd, all our spaces available on in taxis and buses and so could be occupied by persons wearing masks and who would have washed their hands and would have sanitized their hands on a regular basis and who would not be touching their faces and so on and who would not be coughing into other people's space. So that's an important part. With respect to recreation, we expect that if our numbers continue on the same trajectory as they are now, that by June 20th, we should be able to be reopening our bars, our gyms, our casinos, our cinemas, and have in-house dining at restaurants and have sporting activities taking place. Sporting activities without the stadium crowds, but activities on the field. So that's by June 20. Okay, yeah, the announcement is expected on the 20th for the restart on the 22nd. And as I said, gatherings of 10 people would be allowed going forward, but those 10 people would distance themselves appropriately. What this would mean, ladies and gentlemen, if you add up all the things that we have released in the last month or so, it would mean that the country, having its manufacturing sector reopened, its public service reopened, its ecclesiastical places of worship reopened, the only things that would really not be opened would be the school system and their associate teachers going to work and so on. But there will be teachers going out in preparation, and that is allowed. And, of course, our borders. So by June 22nd, which is 2 weeks from today, given all the things that would have happened and are now to happen, this country should be back to approximately 80% of its functionality, with the restrictions of the protocols of personal behavior. Wearing a mask, washing hands, sanitizing hands, not touching, not hugging and kissing, and of course, if you're going out, especially if you're going out, be very careful how you associate with your elderly at home. And of course, Doc, I'm not sure, but those of us with newborns, we have to be careful as well, right? Okay. And that being so, the school system, the target that we're looking at there is to reopen in September for normal. But before the September opening, we have two sets of exams, the external exams, the CXC, CSEC exams, and those have been announced already with a date which seems to, there's some dissatisfaction in some quarters. But you must remember that Trinidad and Tobago is part of a regional body, and that decision taken by CXC is not a government decision. CXC is servicing the region, and what decision has been taken there after discussion is not often that, not every time you'll get unanimity, but the CXC exams have been set, and Trinidad and Tobago should and would participate. The local exam, which is our SEA exam to place our younger children in high school, we expect to announce that during this coming week, because what we have done, we've consulted very widely. We're seeking to get some element of consensus. There's some different views between the parents, the church bodies, the union, and so on. We're trying to get as close as possible to a date that all can work with. We appointed a group to work with these clients and stakeholders to come to a position, and we expect, I expect that I will be advised during this week, and the date should be known. There's a view that the exam should take place in October. There are other views that the exam should take place earlier. We're going to make a decision on that this week. And as soon as that decision is made and accepted by the cabinet, it will be made available, hopefully before the end of the week. As soon as we get as close to consensus as we can on that decision, we let the parents and children know when that SEA exam will take place, And that exam is meant to give us the opportunity to have children get their school places by competition. There's a view that there's 2 months required for the having of the exam and what follows from the writing of the exam. 2 months from, let's say, the end of this coming week would put us into well into August, thereabouts, and therefore the view, some people believe that it should be in October, but then that would have far-reaching consequences. It would mean that the first term would be sacrificed. There's another view that we could get the exam done in time to save that term, so a decision would be made on that this week. Because if the exam can be had earlier to get the children into school by September, if that could be done without too much logistical trauma and impossibilities, we'll see if that is the one that we go with, or whether we stick to some traditional schedule and allow the exam to be take place a bit later, which means that if the exam takes place in October, the new children can't get into high school before January. So that's what we're grappling with at this time, and hopefully we will have a decision one way or the other in the next few days. I think that is as much as I would want to say at this time, except to say that when we open the bars, we expect that there would be some kind of congregating to take place there, and that particular action will be governed by some restrictions of numbers. Maybe the same restriction of 10 would apply at any one time, 10 persons at a bar, and fairly well spaced out. And we could start with that with an announcement that we would make on the 20th. Having made these announcements today, we will let this work. We will let this system work and have no further announcement of changes until the 20th. Unless, of course, God forbid, that something horrendous begins to happen and we have to change our optimism from these positions. But if no such thing happens, we will work this system as I've just described all the way to the 20th, which means for another 2 weeks. And on the 20th, we'll meet again. And by that time, we would have cleared up the issue of the school side of things. And then the only thing that would be there for us to adjust and to address as a consequence of the closures that we have done would be our border arrangement. And that would allow me at this time to ask the Minister of National Security, who is managing the border arrangements with the Minister of Health and myself, to tell you where we at and where we aim to be going with respect to the management of the closed border, with some exemptions allowing a flow of people on the outside to come in and join us in Trinidad and Tobago. Minister of National Security.
Thank you very much, Prime Minister. Good afternoon, Prime Minister, colleagues, members of the media, wider viewing and listening public of Trinidad and Tobago. As you are aware, we've been managing our borders since the 23rd of March of this year, when we closed off our borders to all nationals and non-nationals. You'd have seen us allowing the entrance of groups of persons, nationals, back into Trinidad and Tobago in a manner that allowed us to feed them into our public health system. Just to start off, we are very sympathetic and we have a lot of empathy for all of our nationals who are outside of Trinidad and Tobago. Believe me, we are getting thousands of requests, and I understand the difficulty, we as a government understand the difficulty that each family is facing as they try to get their family member who is outside back in. The things that govern the management of who and how we allow things back in are quite simple. It comes down to numbers and our public health system and what our public health system can control. There are two sides of it. The state quarantine is the policy that we've decided on based on the advice of our public health officials. It's been accepted by us at Cabinet that everyone coming back into Trinidad and Tobago will be put into state quarantine facilities. There's a little bit of leeway that we're now trying to develop, that you may be under state supervision outside of a state quarantine facility, but that is only a limited number. There are two concepts that govern this. One is, God forbid that we suddenly have a surge or a spike and persons come back, there's a reimportation in a group or in groups, and there is a takeoff of positive cases. We have to make sure that the COVID public health care system can manage it. Our hospital beds can manage it. So we're always mindful of that. And then even on the state quarantine, there are limited number of spaces, but as we start to look at increasing those spaces to allow certain persons to pay, and I'll get into that in a short while, we still require the public health officers to do the supervision. So I'm going to take you through what we're facing in the next 7 days. In the next 7 days, we expect to be dealing with somewhere between 600 to 1,000 persons returning to Trinidad and Tobago. You all would recall recently we had the cruise ship workers. So far, we've taken in 87 cruise ship workers. We had 6 initially, 52, and then 29 a few days ago. All of them are currently in state quarantine facilities. There's another set, 19 to come. We have still, you would recall, almost a month ago, we granted approval to persons in Venezuela and Guyana. They're still making their way back. We expect this week 30 from Guyana, 10 to 12 from Guyana, 30 from Venezuela. We have what I think is another success story, and I'd like to thank the Prime Minister for the ability for us to do this. There was a gentleman, a national of ours, an elderly national, who went out to St. Lucia. He was invited by a friend to travel. He is visually impaired, and he has underlying health issues. He got stuck outside of there, and we've been looking for an opportunity to assist him coming back in because he doesn't have the means. We had 5 workers who were in Nevis, and their employer wanted to fly them back. We have managed successfully to negotiate for the owner of that company, the employer of the 5 workers, to send the plane to St. Lucia to pick up this visually impaired gentleman, bring him back, pick up the 5 workers, and to make their way back on Wednesday of this week. We expect that. The employer has gone further and will be one of our first test cases. His 5 workers will be put up in a facility where they will pay for it, one of our hotels, and the state supervision will take place. We have rig workers. We have 98 rig workers who are out on a rig at sea, and we've agreed to allow them to come back, and they will be allowing the facility of them quarantining on the rig. But again, even whilst on the rig, no one will be allowed to interact with them, save for our public health officials who will do the state supervision quarantine. So that's 98 there. Yesterday, we successfully completed discussions with Royal Caribbean Cruise Line, and we expect between 326 to 360 Royal Caribbean workers who are nationals, Trinidad and Tobago nationals, to return on Friday coming. We have managed to negotiate that the Royal Caribbean, right now they're being put onto a ship in Barbados from all different ships. We've had some nationals come from as far as Europe, and Royal Caribbean will put them all onto one vessel, sail into our waters. The quarantine period will start on Friday. Once they arrive here, the Ministry of Health is preparing teams of doctors to test everyone who arrives on Friday, and then they will be quarantined on the ship. We expect all of them to stay in their cabins. The company has agreed that each cabin will have its own bathroom facilities, so there's no need for interaction, so we can manage the state quarantine. Even in that system, our doctors will be on a daily basis monitoring these 326 to 360 workers, so you can understand the capacity issues. So even though they're not on state quarantine facilities, we are still required through our Ministry of Health personnel to continue quarantining them. So that's 326 to 360 we expect to arrive on Friday. We are finally getting to the point where we will finalize the numbers for the return of our students from UWI, Jamaica, Mona, and Barbados, Cave Hill. I have been in constant contact with the principals from Cave Hill and Mona, and they've been helping us to work out the numbers. Right now, we expect 85 of our nationals from Barbados to return, And last weekend, it was 567 Trinidad and Tobago nationals. Today, it seems to be around 127. So you see the disparity and how persons are changing their mind as we get closer. We are aiming to do that exercise next week, Saturday, so June 13th. So you have 360 possibly on Friday, and then it could be up to over 300 to 400 on the Saturday. And what we're doing is we're preparing to quarantine them at the St. Augustine campus. So right now, the Ministry of Health personnel are working with the Trinidad and Tobago Defense Force to get there prepared. The reason for this timing is the students wanted to complete their examinations, and there's some still in examinations. So we have to get St. Augustine campus ready to receive them. It'll become a state quarantine facility, and ensure they have access to internet and these types of things as they do their online examinations. We have also been allowing some of our nationals who are working on ships, service ships in the oil and gas industry, as well as some rigs, to be disembarking and to be coming back to Trinidad and Tobago over the period of time, because some of them have been out to sea for over 150 days. So when we liaise with the Ministry of Health personnel, we're able to work out various protocols. We are aware that we have nationals in Mexico, for example, another set of workers who are in the oil industry, over 35 to 40, and another 40, so somewhere around 70 there. We have persons in the United Kingdom, the United States, Canada, the Middle East, Australia, Bangladesh, and India. All of these places that we are working on being able to bring home. As we've said repeatedly, all of our nationals will come home. But as I've at pains to try and explain, we have to manage the numbers, because right now the best way of us containing any re-importation of the virus into Trinidad and Tobago, because it is possible and we suspect it will happen, is to ensure that everyone that returns we have under state supervision and state quarantine facilities. There's one other thing I saw starting to recirculate today, an announcement by the President of the United States all the way back at the beginning of April about if countries don't take back their nationals, there will be sanctions with passports. That was a very specific presidential executive order, thank you, Prime Minister, and it is dealing with deportees. So persons, of course, are trying to spin that today to say that if we don't take back our nationals who are in the United States, that we will be sanctioned with our visas. That is not so. That is specific to the deportees. I can say here that in Ministry of National Security, we have been in touch with the United States authorities, and we are working out with them. They intend to deport 25 Trinidad and Tobago nationals sometime in this month of June, and we're working towards that. Right now, Ministry of National Security, along with Ministry of Health, are preparing a specific facility in addition to what we have at Santa Rosa to be able to receive these deportees. So in the immediate, those are the numbers of persons that we expect to come back within the next week. And I am working with the Ministry of Health based on the capacity that the Ministry of Health has to bring our nationals back after consultation and giving the advice to the Honorable Prime Minister and Minister of Health. We will manage everyone back. We just need to get through these two big categories that are going to take us up to over 1,000 at a given point in time. And whilst we're doing that, we will be contacting the various nationals we have all over the globe to try and work out the numbers and how we bring you back to be able to manage you in our state quarantine facilities, and if we can, in supervised facilities being supervised by the Ministry of Health. Thank you very much, Prime Minister.
Thank you, Minister Young. Let me just, for clarity, emphasize that the gentleman in St. Lucia who needs assistance and who would be coming in on Wednesday, he would be quarantined at state expense. So the employer of the other four would look after them at the employer's expense, but the gentleman who is being assisted, he will go into a state facility at state expense. So I hope I don't trigger firestorm over that from a particular quarter. Secondly, you would observe that we have been giving priority to people who are ordinarily domiciled in Trinidad and Tobago and who were caught outside by the border closure. For example, our oil company technical people who are working on rigs both at home and abroad, they are normally resident here in Trinidad and Tobago, and they would go out for sessions of a month or 6 weeks or so. They were caught outside. And what we've been trying to do is to bring them back in as part of the priority. So if you see us doing that, it's because we are acknowledging that they are normally domiciled in Trinidad and Tobago. Other people who are Trinidad and Tobago citizens but are normally domiciled elsewhere and would want to come home because sometime, recently we have become a real place and a lot of people want to come home. Those persons will be free to come home when the border is open, but in the meantime, as we manage the inflow, especially from places where the virus is still raging, in case Trinidad and Tobago doesn't understand it, I saw a long description from a person who has some standing in the national community and used that standing to determine that we have no COVID in Trinidad and Tobago. I think that is a very irresponsible comment. It doesn't help us because we are not generating confirmations in the way that other people are. It does not mean that we should drop our guard. Let us thank God that we are in a position not to be receiving confirmations. But it would be foolish for us to say that we are the first country in the world to declare that there's no COVID in this country. People have died in this country from COVID, in case you all have forgotten that. People are coming into this country, and as they come in, they have tested positive for COVID. We are bringing people in on a daily basis. So the government is not taking the position that this country is COVID-free. What we are saying is that we have been able to manage it in such a way that the instances of confirmations have been low to non-existent in a few days. But we expect and would not be surprised if in the coming days and weeks that we get confirmations or presentations in our country. If it doesn't happen, then we say thank God. If it does happen, then we are well prepared to respond. Both physically, we have the infrastructure, as Minister Young has shown you, we are able to handle up to 1,000 people within that fortnight period. Then that means we have to then back away for a few days, and then we'll be able to bring in a lot more people. And as we go further down the road, if we have the same kind of infection level, more and more people can come home. And the reason why we are keeping our border closed is not because we want to punish anybody, not because we are stupid, not because we don't have the intellect of those who are advising us to do otherwise, but because right next door to us is one of the largest countries in the Western Hemisphere where the virus is raging and killing thousands of people on a weekly basis. In the United States, where we have tremendous contact, virtually every family in this country has a family member in North America, either in the United States or Canada. And if the borders were open, you mark my word, lots of those persons would have beaten a path to Trinidad and Tobago because Trinidad and Tobago provides a better option for them at this time. And you had better believe that. So if we have to manage that situation where the virus is present and increasing in some places in North America, we're just seeing increases close to us in Suriname. Thank God in the islands around us, smaller populations, a little more isolated, we have been able to manage it. Our friends and cousins in Jamaica, they had some serious challenges. It appears as though, it is slowing down. We're hoping for that. But we just have to make the best of our situation. And that's why the border closure would be the last hurdle that we'll have to manage, even as the numbers remain low. And if we get infections coming into us, we're taking in hundreds of people in a week. Chances are we might have people who confirm positive when they get here, and then we have to manage that. Having not had community spread in this country, it's not accidental. It is as a result of the protocols that we have followed under the guidance of our health staff. So that is where we are at the moment, and I said we will have the next meeting on the 20th. That's going to be an interesting meeting. It might be virtual, because I'll be in Tobago on the 20th, and I'll speak to you from Tobago on the 20th. You know, if I had said Arima, you wouldn't say that.
But I want to come to
Tobago is an integral part of the nation of Trinidad and Tobago. And of course, the connection between Trinidad and Tobago now is A1, and you may be required to come across. And members of the media, we will be in touch with you in whatever best way there is, but the adjustments will come, because we want to speak to you on the 20th for what's going to happen on the 22nd. The 19th is a holiday. That's Labor Day. So I plan to spend Labor Day in Tobago and have this connection with you on the 20th. And we have Corpus Christi this week.
Yes.
And for those of you who would have liked churches to be open, I must tell you that the virtual services are just as stimulating and far more convenient. And if you accept them in the concept of what we have been taught, where 2 or 3 are gathered, 2 or 3, that's all he asked for. Never seen a number say where the thousands are, except they come to be fed. So hopefully we will have a Corpus Christi that is a little different, but we would still maintain it for those of us who observe the Christian calendar as one of those very important days, COVID or no COVID. So I want to wish all members of the Christian community a holy, sacred, and reflective Corpus Christi as we thank God for taking us through this period where we face these challenges and continue to face them. It could easily have been worse. Let us not forget that. It could easily have been worse. Living through a pandemic in a world where connections are as they are, interconnected as we are, this could have been so much worse for us as a people, as a region, and even as a world. So far, we are having a lot that we can be thankful for, and the people of Trinidad and Tobago must be eternally grateful. And this is as good a time, once again, for me on behalf of the grateful citizens of Trinidad and Tobago to continue to thank our healthcare providers or healthcare givers and all those who are involved in healthcare delivery and those who have gone out to work at all workstations, whether it is in the security services, at the factory floor, or at the fence line. Wherever you are, you come out and let us try to rebuild what has been disrupted by this very dangerous threat. So at this time, we'll take your questions and hope that you would assist us in communicating with the national community. The last time we met, I think we had confined our questions to COVID. I think today we can have a few more questions since there are some more interesting developments taking place, and I'm sure the Minister of Health might be in a position to answer a few of your non-COVID questions today. If he can't answer them, he'll pass them on to me, and if I can't answer them, I pass them on to the CMO. Question time.
They are basically reordering their priorities in terms of spending. So we are seeing not only in Trinidad but all over the world, large companies, Walmart and so on, closing down hundreds of stores. In Trinidad, some companies we've seen in today's papers, workers are being furloughed, and allegedly in some instances for 3 months and so forth. But does the government does the government feel it has an obligation to step in and provide assistance to people who continue to be laid off, and that sort of operating on the basis that it's going to go past the 3 months you all had assistance for were April, May, and June. This may go past this period. What is the government's position with private companies that are laying off people because they are just not able to continue?
Let us back up a bit. And if you ever have the time, I think the ministry will have to do that. Trinidad and Tobago has, as part of its operations, pre-COVID, a very strong social support system. With the coming of COVID, acknowledging what you have just said, anticipating the disruption and the losses that were going to take place, the government took a number of preemptive steps. Most of those preemptive steps were meant to create breath and breathing space for the private sector to survive and to continue. That remains in place. The public service has lost no income. The government continued to pay public servants at all levels, so there's no loss of income there. As a matter of fact, some of those public servants should be better off, having not had to go out and incur the expenses that they would have normally incurred on a daily basis, because the government paid for time not taken. Now that we are going back, as per anticipation, you see, when we started out, we said it looks as if this would take us to June. We've just concluded some discussions, some adjustments here, which takes us to the end of June. So whatever we anticipated to take us to the end of June, that is still in place. But many persons have come back to work before the end of June. Manufacturing came back earlier than we anticipated. Because if this thing had gone worse, we couldn't have opened up the manufacturing sector. We would have had to stay with the essentials for a longer period, and then the demand on the government would have been greater. I would expect when the numbers are just worked out, that we should see fewer than anticipated persons who could have been on the system until June 30th. Because all those people who came back out to work well before now ought not to be on the state support system. And that is why we have to screen who is getting this assistance. Because we don't want people who come back out to work and getting an income to continue to pursue getting an income which was anticipated could have been available to them until the end of June. We have to determine who qualifies for this. And then the government might find itself in a position to go a little further on in supporting those who have not been fortunate enough to get back to work or who are unemployed. Because the system for the unemployed, which are those people who are unable to look after themselves to find a meal and so on, the Ministry of Social Development had been there and providing those families, especially families with children, with support. So it's a complicated equation, but thank God more people are coming out to work, and the public service has maintained its payments. The government is the largest employer in this country, and the government has maintained that position. And that is not necessarily an automatic position. Eh? You would have seen in other territories close by where the public service did not enjoy, the public service did not enjoy that security. And everything that the government has done in order to treat with this disruptive period has a cost, a significant cost. And that cost is largely being funded by borrowings because we didn't have a surplus in our budget. Because everything that we set out to do before and were doing before is still being funded. But we borrowed significant sums of money to meet these expenses, and there's a limit to what the government can do. There's a limit. With respect to how private sector people manage their business within their boardrooms and in their companies, what the government has done is to create an enabling environment. an assistance environment. The government worked with the banks to ensure that their banking arrangements are easier on them. The government paid up a significant portion of debt that was owed to them so they can have cash in hand. The government has put taxpayers' money in the credit union, $200 million worth, for small borrowers to go and get quick loans, small amount, interest-free. The government has now committed another $300 million to small and medium enterprises for them to continue businesses. So insofar as there is an intention to continue in business, as we want them to continue in business, there are a number of windows of facilitation funded by the state. And of course, at the level of the larger businesses, we have done, for example, when we say that we reduce the reserve requirement in the central bank, that might mean nothing to the man in the street who is dealing with an account of $1,000 or $2,000. But it ought to mean a lot for the big businesses in this country. Because what we have done there is to make more money available on better terms. And what we have to see is to make sure that there's a pass on of this from the central bank to the user of the money, and not just become another avenue for profit in between. Because as I said at the beginning, we are all in this together. And this thing is so all-pervasive that everybody is going to carry a portion, or will be required to carry a portion of this burden. And we have to try and make sure that that is what it is. So big business, medium business, small business, individual, private sole trader, person who has lost his or her job, we are all affected by this disruption. But thankfully, we are coming out of it. And I remain optimistic that our business sector, our private sector, our public sector business, that we can be coming out of it cautiously, but as the confidence returns to the population, that purchasing power would be made to bear on those who are producing, those who are trading, because at the end of the day, it is the consumer who drives the market, the purchasing power and the confidence to even go into the storefront to take part. And we are getting there. Barring some calamitous surprises, we are getting there. So by the end of June, into July, into August, by the time we get to Emancipation Day, which is our third holiday coming up in a period of how many weeks, by the time we get there, hopefully the people of Trinidad and Tobago should be in a position where their confidence in themselves and their own economy should allow our private sector businesses to get back to some semblance of normalcy. And of course, our product for export, our factories are humming, and we are there for export. But of course, external markets are important to us, within the region and outside of the region. Because we sell to CARICOM, and I don't know if you've been following, it is anticipated by some analyses that in some of our CARICOM partners, there could be between 18 and 20% reduction in their GDP. That means their purchasing power, their ability to buy, would have been reduced, and much of what they buy come from Trinidad and Tobago. Most importantly, those families who have been relying on remittances from abroad, from the United States, from Canada, from family members across there, you would have seen the tens of millions of people in those countries who are lining up for unemployment relief, meaning that their job situation is not the same, and one has to assume that they will not be in a position to remit to their family and friends in Trinidad and Tobago as they were doing before. Such persons are the kinds of people who we expect to turn to the social support system of this country. And we still have, our social support system would have moved from, in this quarter, would have moved from the annual $6 billion to upwards by almost $2 billion. And those numbers will be made available to you. We are going to the Parliament sometime in the very near future on Friday. We are having a mid-year review, and the Minister of Finance will be able to give you a tighter picture of how this spending has gone and how we have made it. But the Ministry of Social Development and Family Services has had significant responsibilities and will continue so to do. And I've been answering your questions for a long time, but I hope you get the picture.
Pandemic report from the recovery team, has that been handled, and will the media review the sort of take the thing?
Yes, I have received the draft of the phase one of that, which is the immediate responses, and the Minister of Finance would speak to some of it, because there's significant overlap in what is being touched on and recommended there, as in keeping with what we've already done or are doing or to do in the immediate days ahead and so on. So that is with us now, and the other work is on its way, and I think there are 2 subcommittees still to report, and when they report, we will then be in a position to speak to the next phase going forward. So there's a fair amount of overlap there, and when the Minister of Finance speaks on Friday, we should get a much clearer picture as to what we have been dealing with, what it has been costing us, and how we have been managing. Yes.
I have 2 questions for the Minister of National Security.
Just identify yourself, please, so we can know.
Sure, Crystal Wilson from TTT Limited. You mentioned earlier the return of UWI students, and you mentioned the return of students from Barbados. Can I also ask what's happening with the students from Jamaica? That's 1. And 2, I saw a story in today's Guardian with regard to a group of nationals requesting to return home from the US. I think the group is headed by Ms. Alana Belcom. The story says they were denied, they had their applications denied, and I know that you have been saying all nationals will return. Can you respond?
Absolutely.
Let me start with the first one. The UWI students in Jamaica are included. So right now we're working out the numbers. Last weekend, the principal at UWI, the Mona campus, told me it was 567 Trinidad and Tobago national students to return. Today, during the exercise throughout this week, is now 127. So the numbers are moving. At this stage, what we're looking at is the University of the West Indies students in Jamaica and in Barbados. All right. With respect to the article, I too saw it in the Guardian today. As the Prime Minister alluded to a short while ago, and as I have said, we have thousands of persons all over the globe, nationals who want to return. The individual in particular, Professor or Dr. Belcon, from what I gather, because there's been communication, she was at a university somewhere in California working, didn't come home before that, but of course her contract comes to an end, I think at the end of May or something like that, so post our borders being closed, and she started a Facebook group to see who wanted to come home. Everyone will come home, but obviously by now you all realize it can't all come home at the same point in time. We're also managing, as I've been at pains to state, balancing with what our state quarantine facilities and state supervised quarantine facilities can do. That's why I took the time to set out today that in the next week we're expecting over 1,000 nationals to return. If there's a spread of COVID in that, we only have approximately 300 to 400 beds in our system designed to take positive COVID cases. So we have to keep balancing that as well as the state supervision side. So when we say everyone can come home, we mean it, but it is in a managed process, and it can't all come at the same time. There are no commercial flights from the United States. There are no commercial flights from the United Kingdom, from Canada. So we're also managing that process. Now, when we say that you can't come because I'm required to respond, so I very carefully, I'm sure by now you all would have gotten a copy. I have not given the media the copies of my communication with people because I see that as a breach of the privacy of communication between me and them. But they're free to give our responses to you, the media, as they've been doing. And you see how carefully crafted the response is. And we give the reason why. We say we're balancing our facilities. It can't happen right now. I mean, by all means, we now have them in the system. As soon as we can take in these other groups, is what I'm trying to convey this afternoon, we will. We need to get over these next 2 large groups. We need to then air out our facilities. Let's hope we get no positives. One of the things I wanted to emphasize, Prime Minister, we managed to negotiate to utilize a cruise ship for the 326 to 360 workers. That gives us a bit more flexibility. But one of the discussions we're having with Ministry of Health is the possibility of decanting them at various phases off of the ship into the state facilities for closer management. So it is a very fluid thing. So yes, it is Ms. Belcon and many others. There was another one with a gentleman in Suriname, right? And when I explored it, he could have come home when we allowed the persons from Suriname to come home. But he said he took a decision to continue working. And now we can't work it like that. They can't let in one person from here while we're doing with a big group. So we continue to manage the system according to our public health capacity. Simple.
Let me say something here. There are people who see this as an opportunity to be two-faced. In one breath, they're calling for action opposite to what the government is doing. They're holding themselves out as wanting to participate in the management of this crisis. But behind your back, they're moving heaven and earth to create problems for Trinidad and Tobago. There's one particular member of parliament who has legal training of some sort and jumps out here publicly calling for all kinds of cooperation with the government. But behind your back, he's writing and seeking out people abroad, touting, that's what they call touting, and telling people that the government is violating their constitutional rights. And he could get them into Trinidad and Tobago because a denial of entry is a breach of their constitutional rights. I just want to tell that gentleman, who is an organizer of these people, and encouraging them to have their family protest in Trinidad and Tobago and protest on the media and so on. Let me just tell him one thing. COVID-19 does not respect anybody's constitutional right. And all that we are doing in Trinidad and Tobago is to protect the lives of the people of Trinidad and Tobago. And if it is that their contribution is to encourage people to demand their right, expect that the government of Trinidad and Tobago will resist in the protection of the 1.3 million people within our border. So tout as much as you like. And we're not managing this by who shout loudest on the media on the 7 o'clock news. That's not how it is being managed. By now you would have gathered how the government is going about this in a careful, calm, and deliberate way, all meant to give the opportunity for exemptions to be granted, which we said from day one, exemptions, but we are going to preserve our border because common sense tells us to separate ourselves from the raging virus wherever it is. And coming out of North America now, even from a village somewhere in Kentucky, we have to treat you in a particular way because the United States, I think, probably has the highest level of infection going on, not ended, going on right now. My job has been to monitor this. The minister's job has been to open the borders, carefully bring people in, and ensure that nobody's rights are being infringed in any way, and no capricious action by this government. What I do know, that we can't count on our colleagues when Trinidad and Tobago is in trouble.
Let me just add something to what both the Honorable Prime Minister and Minister Young has said. From a health perspective, at the Ministry of Health, we have to assume that everybody that we bring in is a possible COVID positive case. And where do we put them? In the 500 odd beds we have set aside for COVID positive cases. So let's assume you have 100 and something from Jamaica. We have to assume that all 100 and something could possibly turn out to be COVID positive. Where do we put them? So you can't bring in 3,000 people at the same time, knowing that there's a possibility that they are all going to be COVID positive.
Stick up in, Minister. We could. We could bring everybody in. We could bring everybody in who want to come home. But the policy that we have been following is a policy, an expensive policy. The government of Trinidad and Tobago took the position that we'll bring you in and quarantine you in such a way that we can guarantee that you are quarantined. That is a cost to the taxpayer. But that cost is a fraction of the cost of us telling you, come in, go home and be quarantined at home, run free. And then if we had done that, or if we do that, and then we end up with a level of infection that is much higher, where the lockdown would have been longer and more severe, then that is another cost. You would have seen one gentleman came in here from Florida, was COVID positive, run around Trinidad for a few days. And what was the effect of that? We had to close down bank, we had to close down half, but some of you in the media were exposed and the public was exposed to one individual running around here. Just picture a situation where we had said, yes, okay, come on home if you want to come home. And when you come home, you go and quarantine yourself in Mason Hall and wherever you live. And then Trinidad and Tobago would have had the kind of investment that we would have regretted. Had we done that, the result would have been different. It has nothing to do with climate and weather, as some people tell you. It has to do with how we have managed it. It was managed at a cost, and we will continue so to do because it has worked for us. And all this encouragement to open the border and let people come back home and run riot around us, that is what they want. That's what they're asking us to do. Last week, the Minister of Health made a comment about persons paying for quarantine over and above what we have already put in place. And we're doing that. Some people are able to do that. If you want further assistance and you are able to do that, but we maintain the public system. I saw a response from the leader of the opposition and her party excoriating the health department for fooling the population and making the statement that there never was a parallel health system. And all that we have said about that is a lie. Now, what manner of public official would make a statement like that in Trinidad and Tobago? We have a brand new hospital in Arima, built by this government, and I'm going to open it on Tuesday. That hospital has been dedicated to the handling and our operations in the COVID response. We've got a brand new hospital in Point Fortin, paid for and built by this government. That too was reserved for COVID. A portion of the Couva Hospital, which had not been opened, the other part was open. This part, the adult bed section was not open. We reserved that and was using that. And then we hired a number of facilities which were not part of the health system. And we accepted from the private sector certain facilities. And I could tell you without fear of contradiction, Trinidad and Tobago has a parallel health system. Dedicated healthcare professionals to these facilities to provide that. And I have to see the leader of the opposition and the party telling the country that we are lying to the country. There was never any parallel, and it's climate that caused us not to have an outbreak of COVID. And of course, we have stolen $20 billion, and therefore we are taxing tax. All this is just so much rubbish. And the Minister of Finance on Friday will tell the country exactly how many billions of dollars we've spent or borrowed or have in line to deal with this issue. And we are just up to our eyeballs with the lies, with the lies, with the lies. Up to our eyeballs with that. Seeking to impress you, the people of Trinidad and Tobago. We have one responsibility, and that responsibility is the interest of all the people of Trinidad and Tobago. And I dare say, in this period, on this issue, Trinidad and Tobago has distinguished itself in looking after the interests of all the people of Trinidad and Tobago, including those who are outside seeking to come home. And they will eventually get home, and we'll eventually lower our border and get back to some semblance of normalcy. As I speak to you now, the airline industry has no idea when those planes will get back up into the air. In fact, they're looking the other way around as to how much of the airline industry will go under. And planes are being pulled out of service now in anticipation of a long period, a longer period of no use and no service. We have an airline which we are maintaining, because you have to maintain our pilots and our stewardesses and our engineers in the event that we come to a point where we can restart. You can't go and find engineers off the street or easily find them. The day we come to a point where we can restart our international service, Caribbean Airlines should be there and would be there. And it's costing taxpayers money, not the government. Taxpayers, all the expenditure is taxpayers. We are simply the managers and trustees of the public interest. And we have faith in our future, and that is why we are keeping Caribbean Airlines whole and ready. We have faith in our future. That is why we have bought new ferries, and very soon one would be here before the second one comes at the end of the year. And we think Tobago has a bright future in local, regional, and international tourism. We are supporting our manufacturing sector because we believe we have a future. We're supporting our banking system because we believe we have a future. And if there are others who don't believe in the future of Trinidad and Tobago, we, this government, believe that the people of Trinidad and Tobago have a future, and we're there with them.
One with relation to the continuing closure of schools and associated organizations. I know in the week that the health officials would have addressed the issue of daycare, but we continue to have questions coming forward as to whether or not daycares can open for just a period of time and small amounts, because they do have parents who have gone back to work. And with regards to the reopening of religious organizations, I know you've said alternate pews, keep everyone, arm's length, but there are some really large worship halls in the various faiths that can take can take quite a bit of persons, even with those social distancing measures. Is there a maximum recommended number of persons for those?
Once you follow the guideline, it's not restricted by the size of the building. If it's a small church and you do the same thing, alternate pews, arm's length, then there's a certain number of people that you can accommodate. If you go to a much larger one like the cathedral, using the same formula, then you accommodate more people. If you go to the mosque, where there are not pews, we expect that the protocols will ask that you mark the floor and people can take part in the proceedings at the mosque using the same spacing. So just follow the formula, and that will determine how many persons can worship within the building.
And that is a 1 hour long service, you said?
We are requesting that. It's a request, it's a recommendation. Because you see, the longer you are exposed, the greater the risk. Right? So we're saying that if you're gathered in that kind of congregation, then we think that an hour you should be able to communicate as you would like to, and not overly expose us. Because at the end of the day, what we're doing here is managing risk. We're managing risk. Yes, if you could mention, answer the question with respect to the young children.
Yeah, so as I said earlier in the week, I think the same question was asked at one of the press conferences. Once you deal with children, there's no social distancing that could take place. Sanitization is difficult. So we were recommending that all events related to children be maintained with what we're looking at for schools. That was my recommendation in the first onset, and we got questions offline from persons asking about sporting activities with children. We maintain the same thing, that we need to give our children that time. September is what the Ministry of Education is looking at, and I think everything related to children should be maintained at that phase, because we have seen in other territories, as soon as they open their schools, their infection rate has gone up within about 3 or 4 days. That has happened in many parts of the world. There's only so much you can do in terms of social distancing in a school setting. So it basically levels the playing field in terms of infectious disease once you let children congregate. So we wish that holds until September.
There's one country in Europe that started with their children in the reopening, and an issue has arisen where parents are now questioning whether the government had used the children as guinea pigs, because they were the first to be put back out under the understanding that the children had some level of resistance. And was it that? In fact, some parents refused to send their children to school because it was a trial and error situation. And we know in Trinidad and Tobago it wouldn't take long. If we bring the children out and we get a reinfection, that's exactly what's going to be said to us. And I didn't mention beaches. but our beaches and rivers we should speak to that on the 20th with an aim of opening it on the 22nd, opening them on the 22nd. So beaches and rivers, I'm sure if I didn't mention them today, they being such an integral part of our social existence.
In time for the Tobago meeting.
Yeah, we should be able to go back to those places of recreation by the 22nd. Another 2 weeks, and our beaches and rivers should be opened up again in the context of our spatial responses. And a number.
Now, St. Kitts and Nevis held an election, and they chose not to open their borders. Today, I think it's in today's papers, the opposition leader has signaled that if there's any calling of an election before the opening of the borders, she will challenge this in court. Are you prepared to give any undertaking that before the opening of the borders, there will not be the calling of any election? And also, what is the situation with political campaigning, which you didn't mention in all of this? What is the situation with that between now, the 22nd? When can that
Start, commence.
All I can say to that is that Trinidad and Tobago has a responsible government, and that government observes the law, and the supreme law in this country is the Constitution. The Constitution determines how and when an election could be called, and it has nothing to do with the foibles of any opposition leader. Secondly, our decisions with respect to our health, as inscribed in our protection granted by the Public Health Ordinance, is the law of Trinidad and Tobago. And all those who believe that they own the courthouse and that is where they will conduct their politics, they're free to do so. And I will not be fazed by the threats of the opposition leader. If she had anything useful to say, she would have said it. And the fact that she is so obsessed with elections should tell this country all the country needs to know. We are obsessed by other things, election not being the number one priority. The number one priority in this country is to ensure that we minimize our exposure and our disruption by a virus in a pandemic. And if she knows there's a law that says that in a pandemic you have no elections, I thought I heard her calling for the election. Well, the opening of the border is a matter for the government of Trinidad and Tobago. And if she so wants the border open, I know why she wants the border open. I guess if the border is open, her members can come back home as they should. I could see her wanting her members to come back home. But that is not the basis on which we conduct the health care issues of Trinidad and Tobago. Wanting an itinerant member to come home is not sufficient reason to open our border. The border is closed for a reason, and its opening, partially or in total, would be a public health issue and not an election issue.
Can I just ask Minister DEYALSINGH, I have one question, please. In respect of I know we've spoken before about the OSH guidelines guiding employers as to the proper protocols needed to have employees return to work. Employees who are concerned, especially in the private sector, because there may be some employers who may not be adhering to those guidelines, and what sort of assistance what sort of are inspections going to be done in respect of some of these private enterprises, and as well as for if you could give us any update on whether or not the 50 persons who would have been brought on to assist with the inspections that were taking place.
Okay.
Has that been finalized?
So the permanent secretary is working with the dean of the Faculty of Medical Sciences to source those 50 people. I will have an update on Monday, and the CMO can give you his
so
view
in
on
terms
the
of the guidelines themselves, we have been working very closely with private and public sector to ensure that everybody adheres to the guideline. The guidelines are understood and operationalized as best as possible. Our Public Health Inspectorate, as well as the Public Health Inspectorate from the regional corporations, have been doing monitoring and evaluation exercises throughout the process, together with members of the Trinidad and Tobago Police Service. Of course, if there's instances of risk, you can communicate to the Ministry of Health or even Ministry of National Security, I suppose, and we can follow up on those individual areas and send our teams into those organizations.
With those sorts of complaints, you can always let us know. And OSH is the organization that has been set up under the legislation. If there's an unsafe place of work or there are concerns about your place of work, you all can go ahead and make the complaints. Whoever it is can make the complaints to OSH or the public health sector, or by all means, Trinidad and Tobago Police Service.
And you also have the Ministry of Labour. All these are avenues open to anybody with complaints.
Given what is happening around the world with all the protests and demonstrations against serious racism and its reverberations in Trinidad and Tobago, we've seen on social media people saying things that have been deemed insensitive, racist. What does the government have a position, and does it have a plan to deal with this situation so that we do not have any kind of confrontation or any sort of worsening of race relations in the country?
Well, racism and the issue of race relations have always been an integral part of our Western world, as other parts of the world as well. But in the Western world, North America, South America, the Caribbean, race and racism have always been an integral factor. We here in Trinidad and Tobago, we are a multiracial, multi-ethnic, multicultural society. Our Caribbean region is similarly described in many of our countries. And we too have the perils of what we're seeing in North America. What we have done over the years is to acknowledge people striving to get away from the horrors of racism and to subscribe to a higher calling and better angels, accepting that we are all God's people and we are all born with inherent rights. But the fact of the matter is that those rights have to be fought for on a continuous basis. For like a garden with weeds with deep roots, even as you mow the weeds, every so often, there's a regrowth. And if the mowing does not take place, the new shoots can appear and can prevail in the garden. And Trinidad and Tobago ought not to see itself or distance itself from what is happening outside of Trinidad and Tobago on this matter, because like it was in 1970, when the Black Power movement started at Sir George Williams University, Trinidad and Tobago citizens at Sir George Williams University, it's the same issue of racism, where the conversation found its way into the pavements of Port of Spain and the corridors at UWI, and our young people took to the streets. And the next thing you know, by April of 1970, the government of Trinidad and Tobago had to respond, and respond in a way that it had never been called upon to respond before. And that marked that particular period, January 19, 1970 to April 1970 was a period similar. The fear that we have today is that there seems to be a new normal that is developing, where the higher values that we thought we were ascribing to and the gains that we were making could be so easily lost. And here in Trinidad and Tobago, we too have our issues of racism. And this is a time when we should follow the entreaties of our elders, where when your brother's house is on fire, you wet yours. Or if you see your brother's bed on fire, wet yours. There's a lot to be learned from what's happening outside, not just in the United States, but in other communities who are reacting to what is happening elsewhere. Fortunately, we have made sufficient progress, I believe, to bolster us and protect us from the most vulgar of what we are seeing on the outside today. But let us not for 1 minute believe that we are insulated from that, or it doesn't apply to us. I've seen comments from persons who express themselves saying that it's nonsense and we don't have to look at that because all of we is one. That might be true in some quarters and some thought processes. But Trinidad and Tobago, we too have lessons to learn. Thank you very much for coming, and I hope that I'll be able to talk to you from sunny, thriving Tobago on June 20th. And on behalf of all those in Tobago who rely on Trinidad and Tobago visitors, Tobago is open for business. And whenever I'm in Tobago, I observe that my blood pressure is significantly lower. And maybe Doc can explain that to me, why that is so, right? And I encourage you to visit. The transportation is improved, sunlight is bright, and the weather is good. And our population there anxiously awaits you. Thank you very much.
And that was live coverage of a press conference hosted by Prime Minister Dr. Keith Rowley on all the stations of TTT Limited. A quick review of some of the key points we just heard. As of the 8th of June, all hairdressers, barbers, spas, domestic workers, they will be allowed to get back to work, and the public transport capacity will increase to 75%. Now, places of worship can open back activities from the 12th of June with some conditions like initiating sanitizing and physical distancing protocols and making mask wearing a requirement. Now, places of worship are asked to keep their services under an hour, is recommended. From the 22nd of June, the public service should return to complete normalcy, with moving from the phasing of rotational work, and all public transportation should be operating at 100% capacity. Now, many people have been asking about gyms, bars, casinos, cinemas, in-house dining, and the sporting activities should resume on June the 22nd. But remember that the sporting activities will be on the field as opposed to having a watching audience in the stadium or the crowds around. Now, an SEA exam date should be decided this coming week. Dialogue remains involved and ongoing. Now, when bars are reopened, there will be a restriction on gatherings, the exact number of which will be announced on the 20th of June. The Minister of National Security says in the next 7 days, approximately 600 to 1,000 people are expected to return to our shores. Of course, we are being reminded that we must stay at home to stay safe and save lives. I'm DK Rosstar. Stay with us here on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online for the latest COVID-19 news.
News happens anytime, anywhere. And when it happens, we are there. We report the news in real time. TTT News. Connect.